Transplant unit is tough. We see a lot of things. It's not just post-surgical. Anything that might bring them to the hospital, there's just more of a specialized unit, specialized care with the medications, and the doctors trust us to know what's best for them. My name's Audrey Mickail. I'm a nurse here on Dunn West, our transplant unit. Been working here for almost 14 years now, same unit. Morning, Mr. Lonnie. Okay to do my morning medicines? Your vitamin D. You've had a few liver birthdays already. How you been doing? I know you've had to visit us a few times.
I'm doing fine.
Yeah.
Hanging in there.
Hanging in there, okay. All right. Anything else I can do for you, sir?
No, ma'am. I don't think so.
You ready to go walking soon?
Whatever they were in.
Sure. Oh, sure. I'll let them know.
Okay.
All right, sir. Our unit, the transplant unit, is multi-solid organ unit. Our patients come in, it's a big scary journey. They don't know everything is new to them. They're gonna have to change their lifestyle. I enjoy being able to help teach them and guide them through that and work with our doctors, our transplant coordinators, and making their transition easier. My favorite thing about my job is working with my fellow staff and my patients, being able to work with them through this journey of theirs and see them get better. I love you. Have a good one.
This is my favorite thing.
Walking?
Yep.
Just getting out of this room, right?
It feels good.
Your shoes match your earrings. You've got this planned, huh? I like that. Is that your favorite color?
Yes.
Yeah, me too.
It's right in front of you. Try to keep up with you. There we go.
I'm ready. Hope I don't. None of my clothes fit.
Is it time to go shopping?
Yep. Poor husband.
There's a reason why I've been here for so long on this unit, have stayed here. I love the patient population. We get them through this journey and make them, stronger through something a very hard time in their life, and it's fulfilling to see that. As charge nurse, I'm help leading the floor, being a resource for my other fellow nurses. Sometimes we have patients, sometimes we're free if we get the chance, and we learn about every patient, what their barriers to discharge are, what is the next test that we need to help get done. So you're there helping your fellow nurse get those things done, and not just that, but also tasks that they might have for that day. A lot of our staff, if we see someone struggling and say they're not so busy, they ask, what can I do for you? Is there something I can help you with? If we have a cert or someone might be, their vitals might be going down, or we're worried about something happening, they're there to help you. If someone calls for help, everyone's there at one time.
How long have you been here for?
14, you?
11 years.
Yeah. Even our kids know each other. Our kids are growing up together.
I know. What is it?
Yeah.
5 kids, 6 kids between us now?
6 kids?
Yep.
Our other nurse, Morgan, and she's now the manager on our other transplant floor.
Yeah.
She has 3, so 9 kids between us.
I know. It's insane.
Yeah. We all started here as babies ourselves.
Transplant is all I know, and I love it. I love to be able to see patients go from organ failure and the debilities that causes to getting a new chance of life and almost seeing them, transform their life and live their life better. My name is Yadira De Leon. I am an RN, BSN CCTN on Dunn West, the transplant unit. It's not an easy unit. It's a very busy unit, but it's very rewarding, and I honestly feel that Methodist Hospital does really well in picking their employees, because most of my teammates are good nurses and good people, because we all help each other. I always tell them as they're coming in to work with us is that we truly are a team. I love to teach. I love to have a little bit of a say-so or in how our nurses progress. I hope I made a difference in how they think about nursing. Nene is our little PCA firecracker. She joined us, I want to say a good 2-3 years ago, but it feels like she's been there forever with us too. She knows her job, she does it well. And I will follow her lead when we're going into patients' rooms because of the expert she is in patient care.
It's great, huh?
4-7.
Oh, yeah.
My name is Shenetra Thomas. I go by Nene.
I work here on the Transplant Unit, Dunn 4. I've been here for 7 years.
Normally, I would be a PCA, but today I'm being a secretary. PCA normally sees about the patient at bedside. They normally would do vitals, see about the patient throughout the day. But today, I'm sitting at the desk, I'm answering the phone calls from the patients, also from different phone calls that they have that's coming in throughout the hospital to see about the patients, helping out on the unit, being a team player.
I was working doing FedEx, actually a FedEx driver, before I came here. I ended up meeting someone that had a transplant. They kind of like really talked me into like becoming in the health field, and once I got in it, I never left. I've been here ever since. My dad got sick and he had to get a lung transplant. He beat the lung transplant and then he caught cancer. He passed away in 2009. It's kind of been hard. I really wanted to know about it and learn about it more, so that's kind of why I'm here.
She definitely took care of everything I needed.
Yeah.
You just went beyond, because you didn't have me, but you would still stop in and see me.
Yeah,
I
right. I told you remind me of my dad. You know that. You know I had to come check on you.
I don't know if that's good or bad.
That's a good thing.
Okay.
I have one of my favorite patients on the unit right now. Mr. Lonnie remind me of my dad, actually. He's a very sweet guy. I actually love Mr. Lonnie. Mr. Lonnie is real sweet.
I know that.
Well, let me know if you need something, okay?
I'll give you a holler.
All
Ask
right.
you specifically.
Yeah.
Okay.
I'll come back and check on you once your wife come back, okay? So I can talk to her. Okay?
All right.
All right. Have a good day.
When I see a patient leaving, going home after a transplant, it gives me hope for the next patient that comes. It makes you feel good that you did your job. You help that patient out to get them to where they're going.
Being there for 18 years, I have precepted quite a few nurses, and I call them my nursing babies. I'm protective of my babies, and until this day, they still will text me, call me, keep in touch, let me know how they're doing. Yeah, it's a very special bond.
I've stayed on this unit for so long. For the patients, for my staff, I enjoy working with our fellow nurses, our fellow staff here, but also just being part of this family. It's not just my coworkers, they're a big family. And they've been there for me through different parts of my life and have helped me. And so I just feel like a sense of loyalty to like what I call my transplant family.